Want to know how you can boost your collagen naturally that doesn't involve putting collagen supplements in your coffee or sitting under an LED face mask, neck mask, hand mask for 10, 15 minutes every single day of your life? Well, if you're curious, you are going to want to check out this episode. I am going to be breaking down one of my favorite ways to stimulate your own collagen naturally using something known as biostimulants. Maybe you've never heard about biostimulants, but they've actually been around for decades, and they're definitely enjoying a resurgence. I'm Dr. Mina. Welcome to my channel, The Skin Real, where I give real people real skin education and guidance so that they can make healthy and informed decisions about their skin health. Sound good? Let's dive in. Welcome to my weekly recap episode where I share my key takeaways from my recent interview with Dr. Sapna Palep. She is a board-certified dermatologist. She's also the owner and founder of Spring Street Dermatology in Manhattan, and she is a leading New York dermatologist known for her amazing aesthetic eye and her ability to give very natural-looking results for her patients and clear skin, of course. So if you are interested in hearing the full episode, be sure to stick around to the end where I will link that. So basically, what are biostimulants? A lot of times people refer to biostimulants or think of biostimulants as filler, and that's not really accurate. So when I talk about filler with my patients, I'm really talking about something typically with hyaluronic acid. Those are the most common fillers that I use, really the only fillers that I use. So those are going to be products like Juvederm and Restylane, and within those companies, they have tons of different types of fillers that can be used in different locations. Some are going to be thicker hyaluronic acid so that it's good for areas like your cheeks or the temples, and others are going to be a thinner type of hyaluronic acid, and that's going to be great for areas under your eyes, what we call the tear troughs, or your lips. So that's hyaluronic acid fillers. And I would say in the last 15 years, they have really just blown up. We have been filling our faces for over a decade, probably even decades. And there's so many out there. So many people are providing or doing filler injections, not just your dermatologist or plastic surgeon. They're everywhere. But one of the consequences of that is that we have become overfilled in general, right? I'm like doing generalizations here, but if you've ever looked at someone and they just didn't look like themselves, they just didn't look like the person you remember, maybe their cheeks look huge and they never had big cheeks like that. And when they talk, their cheeks don't really move. They're really stiff and firm. And you've seen lips that are just really blown up, not very natural looking, not what that person used to have. That is the overdone look that can happen with hyaluronic acid fillers. And it can be a slippery slope. You start injecting them. Usually you need a lot of syringes. So sometimes patients will come in wanting filler and they think that one syringe is going to do this. But for that overdone look, it really requires lots and lots of syringes. So it's not something that's going to happen typically with one syringe. But what happens is you just start layering and adding on more and more filler. And then you get this distorted view and you forget even what you looked like. So it's always good to look at those iPhone memories that pop up from 5 years ago, 10 years ago. Go back, look at your old wedding pictures, your old graduation pictures. Look back at yourself 10, 20, 30 years ago, however long ago, not because we're trying to reverse the clock back to those days, but just so you have a reference point of what your cheeks look like before you started injecting them, what your lips look like before you started injecting them. Again, just to keep things natural. A lot of people have been scared off by cosmetics because they have seen this sort of overdone, exaggerated look. And certainly some people are going for that look. There are certain people, certain cities, certain industries where that is the goal, that is the look. But that's not really something that I'm going for. I'm more have a natural approach to it. And so if you're listening and that's you, you're definitely going to want to listen to this episode and the full episode. So I have found that for people, and I'm in my mid-40s, that we start to lose our collagen and we start to have what's called hand volume facial loss. And really, it's not just facial loss. We start to lose our collagen everywhere. You lose it in your neck, your hands, your chest. We start to lose our collagen. And it really starts to happen even in our late 20s, but it's exaggerated or exacerbated during perimenopause and menopause, where for women, we have a dramatic drop in our estrogen. Not only are we losing our collagen and elastin that keeps our skin plump, youthful looking, but we also lose muscle mass and we also have bone resorption. So we're actually losing our bone. Our jawbone starts to recede. The bone under our eyes starts to recede and hollow out more. And so that also exacerbates this volume loss that we see, especially in our face. And that is why I love biostimulants, because biostimulants are products that boost your own collagen. So I'm going to be talking about Sculptra here, which is a trade name biostimulant. Another one would be Radiesse. And this is completely unsponsored. I am not being paid to talk about Sculptra. I just really believe in it. I love it for my patients, and I actually use it on myself. So with Sculptra, we take these little particles made up of poly-L-lactic acid. We dilute it with either water or saline, and then we inject that back into someone's face. And we tend to focus on areas like the sides of the face. So our temples, that's a very common area where we start to see hollowing, and that can really age someone. The cheekbones, sides of the face, also our jawbone. And then I love it right here, what we call the nasolabial folds, where we start to see that area start to sag, and the biostimulants can fill that back up. So we inject this mostly water into the face, but it has these little poly-L-lactic acid particles dissolved in it. And then you're going to be swollen for a couple of days. But typically people like this because you see how you look volumized and your skin fuller, and you lose those wrinkles. But that water is going to go away. And then over weeks to months, those poly-L-lactic acid particles stimulate your own collagen to improve volume loss. And it actually not only improves volume loss, but it makes your skin more radiant, brighter, and gives you this glow. And it's even FDA approved for that. So it's kind of like you get 2 for 1 with Sculptra. Now, what are some of the drawbacks of Sculptra? I would say the main drawback is that it takes time. And I tell my patients, if you're interested in volumization over the long term with very natural results, Sculptra is a great way to do this, but it's playing the long game. We don't build our collagen overnight. It takes weeks to months to really see the improvement, but you do see the improvement, and it's very natural. It's subtle. You're not going to wake up one day and look totally different and not look like yourself, which is another reason why I really love Sculptra. You can also use Radiesse. I find that Radiesse, you really have to dilute it because it is made up of something called calcium hydroxyapatite, which is firm and similar to bone. And so it can give a more stiff look unless you really, really dilute it. But you can use these products in the face. You can use it in the neck. You can use it in the chest that loses collagen, tops of the hands. I've even used it when people have scars, either from acne or they have a scar where what we call like a traumatic scar, where they bumped into the edge of a furniture and it left a little divot in their skin. You can actually inject it here to help boost that collagen there. So lots of options for it. I find the best time to start using biostimulants is really before you've noticed dramatic volume loss, because then we don't need to use a lot. And we just kind of use a vial every year, every couple of years to help maintain. Now, if you have never done stuff before and you have significant volume loss, then it is going to take several vials to really get the benefit you're looking for. It's not a one-time treatment. We're going to see you every month, every 4 to 6 weeks for several treatments. And then we let the product work. We let your body build that collagen naturally. Again, it's not a quick fix. And I would just say with a lot of things in aesthetics and dermatology, if someone's promising you overnight results, quick fix, then I would use a little caution, because our skin, it's a living organ and it doesn't just magically reverse things overnight. So be patient and you really will reap the rewards of biostimulants if this is something you're interested in. Now you may say, who's a good candidate? It's really for anyone with hand volume loss. So again, if someone comes in and they just want a little bit plumper lips, or they just have minimal sort of hollowing under the eyes, or just want a little bit of projection of their chin, then that's something that filler like hyaluronic acid fillers can do nicely. But if I realize it's going to take more than one syringe or max 2 syringes to give them the result they want, then I start to talk about using biostimulants, because it's unrealistic to think you're going to put 5, 6 syringes of hyaluronic acid into someone's face. I think then you're going to get into that sort of stiff, unnatural look. So if it can't be fixed with 1 or 2 syringes of hyaluronic acid filler, then I think talking about biostimulants is a great option. If you are someone who is really into pro-aging and maximizing preventative measures and maintenance, then biostimulants are a great option to start incorporating when you're noticing perhaps a little thinning of your temples, volume loss in your temples. Maybe you feel like you have a little volume loss under your eyes. Then thinking about doing a small amount of biostimulants is a good option. Of course, talk to your board-certified dermatologist about this. And one of the benefits of doing biostimulants is that even though it's a little more money up front, having to pay for the vials, that ultimately it will improve your skin so that you really don't need a lot of products, especially a lot of expensive products down the road, because it's giving your skin that collagen that it needs, that it's lacking. And you are going to see just beautiful, radiant skin from using this, which is another great perk. You don't have to go do other procedures to then get that beautiful skin. The other great thing about biostimulants is that the results are very long lasting. I hear this all the time. How long can I expect my collagen to last? And I tell people it will last as long as your regular collagen. And that really depends on how you take care of your body. A lot of lifestyle things. Are you smoking? Are you tanning? If you're doing those things, it's going to degrade your collagen significantly faster. If you are exercising, sleeping, managing your stress, eating a high protein diet, doing resistance training, these are all things that have been shown to boost your collagen and to keep your body healthy and your skin. And so that's going to help it last longer. But again, it's just like your regular collagen. It will degrade with time, but by taking care of your body, again, from the inside out, you are going to help maximize your collagen and boost it for longer. And of course, make sure you're using a retinoid, which is such a powerful collagen booster as well. Main side effect of biostimulants is that you can get some bruising. I find that usually I'm using a cannula, and so it might just be like a little pinprick of a bruise. I actually feel like I get more bruising with hyaluronic acid filler because I'm using a needle. So you can get bruising with this procedure. Make sure you're not drinking a lot of alcohol before the procedure. Try to avoid things like aspirin or blood thinners unless they're prescribed by your doctor. And then things like arnica, that is a great way to help prevent bruising. You can take some capsules before you come in, and then you can also use a cream as well on the skin to help prevent the bruising, and you can cover it with makeup. Typically, the downtime is not too bad. You are going to be a little bit numb after the treatment, so you may not want to schedule a business meeting or call or important meeting within a couple hours from the procedure because you will have some numbing from lidocaine. So give yourself a couple hours for that to resolve. And you are going to be swollen after the treatment. But again, most people like this swelling because it shows them what's possible when they have that volume restored. There is a little homework for people when they do biostimulants, especially with Sculptra. And that's the rule of 5s. You do need to massage your face or wherever we treated 5 times a day for 5 minutes for 5 days. The reason we do this is because we're helping spread out those poly-L-lactic acid particles so that they don't clump together, because one of the side effects of Sculptra is that you can get nodule formation. Now, typically, if you're good about massaging, this is not a major concern, and with enough time and massage, these little nodules can break down and dissolve. But just know there is a teeny bit of homework after with biostimulants, but again, it's minimal, and I think it's well worth the price. I'm a huge fan of biostimulants. If you want to learn more about them, be sure to check out the full episode with Dr. Palep right here, and I will see you next week.